Good afternoon. I'm Dr. Josef Sempa. I'm a senior lecturer from the University of the Free State. And I'm going to present to you about the evidence on global health researchers' behavior from Research Integrity and Research Fairness Survey. I want to start the presentation with a tale of rats and mosquitoes from one of our bridge collaborators, Dr. Susan Rumisha. Early on in her career, she visited communities in rural parts of her home country, Tanzania. As this is a custom and norm, she spoke to village leaders to inform them about a malaria study her group was planning to conduct. So when she talked to the village leaders listened carefully and then politely replied, "We don't have malaria problems here. Our problem is with rats. Our village is infested with rats and they come and nibble our feet at night. Help us with our rats, with our rat problem, and we will help you with our malaria problem." This interaction is very emblematic of knowledge production in global health research and touches upon several topics covered today, ranging from equitable partnerships to epistemic justice. There are a number of questions that come up here about who decides what is worth studying, whom do we conduct research for, how can science be responsive to the local needs? These questions form part of the backbone of the bridge guidelines for good epidemiological practice. The bridge guidelines provide 6 standards and approximately 40 criteria to guide global health researchers conducting an epidemiological study. It's a sort of checklist of items that researchers should think about step by step. They were developed by means of a Delphi consultation, including 40 experts in global health research from all over the world, and therefore represent an agreed way forward on how to maximize the positive impact of global health research, both on local researchers, to impact global health research, both on local researchers and local communities. The focus of the guidelines is both on research integrity, which entails producing scientifically sound research, as well as research fairness, which entails conducting research in fair partnerships for long-lasting social impact. These guidelines formed the basis of a survey we conducted to study research behavior in a sample of global health researchers. In a nutshell, our research questions were: to what extent does current research practices reflect the ideals set forward in the bridge guidelines? And the second one was, are there differences between researchers based in the global north versus the global south? The methodology for this study was a mixed method survey involving online questionnaires, where we surveyed 146 participants. And it involved in-depth interviews. These were carried out online of approximately 10 participants. This study was conducted between April and September 2022. And the results were, overall, the global South researchers were more likely to report adhering to good research practices. Small but significant differences and consistent across many sub-indicators were noticed. High overall research integrity scores meant in this study that a person high overall research integrity score meant that the researcher was disclosing their funding, meticulously checking work, mentoring flaws in publications, field testing instruments, and many other options, as you can see. Then high overall research fairness score meant consulting data users and communities when designing a study, planning and conducting studies in partnership with all research partners, etc., as you can see on the slide. Given the focus of today's event, we want to mainly report on some key issues regarding research fairness. Overall, our study shows that Global South researchers are more responsive to affected populations and end users' needs during the preparation stage of research. Indeed, Global South researchers reported always consulting representatives of affected populations and frequently consulted end users of research, but both were done less frequently by Global North researchers. Our results also report regarding equitable and just data sharing paint a complicated picture. Generally, Global South and Global North researchers felt that there were always or very frequently fair data ownership agreements. And while Global South researchers generally felt that this was accompanied by strategies to encourage reanalysis by local researchers, Global North researchers felt that this only happened occasionally. This conduct is concerning. While it could be perhaps explained by the biases in our samples, it may also mask some unjust and unfair practices. Generally, both Global South and Global North researchers reported a relatively lower frequency of consulting end users and dissemination of the study results in non-scientific literature. This may reflect a difficulty for researchers across the board to communicate findings to decision makers. In conclusion, there are more important differences in which Global South and Global North researchers approach knowledge production. Generally, Global South researchers reported more desirable behaviors. Global South researchers seem to conduct research in a more responsive way, more responsive to users and communities. And this actually resonates with a tale of the rat and the mosquito. Take care of our rats, we will take care of the mosquito. And so creating that synergy in research. Fair agreements are important, but they should also translate into fair practices. Current results raise questions about the perception of fairness in those agreements. Global North and Global South researchers can join forces to improve the current practice regarding feedback to end users to ensure that study results can feed into decision-making practices and thus have the most impact on people's lives. Thank you so much.